This is for press only. If you're not a member, and watch Department of Health's Twitter page live stream or their Facebook page or on Comcast channel 64 or on Verizon channel 40. We're going to begin our briefing with opening remarks from Mayor Kenney. Mayor, you have the floor.
Thanks, Mike. Good afternoon, everyone. During this pandemic, it is easy to forget about many of the other pervasive health issues that afflict Philadelphians. So I want to take a moment to talk about one such issue, which is diabetes. This colorful background behind me is a reminder that November is National Diabetes Awareness Month. In Philadelphia, nationally, we're seeing higher incidence of prediabetes, particularly among people of color and younger adults, in addition to seniors. Without intervention, many will go on to develop diabetes that can put them at higher risk for other chronic conditions and complications from COVID. I want to tell you about a local group that is working together to offer an important health education program for people in Philadelphia, especially those over 50 years of age. It's called the Philadelphia Diabetes Prevention Collaborative. Even amid the pandemic, we want you to know that services and support are here for you. The Diabetes Prevention Program is being offered by trusted community providers throughout the Philadelphia area. This collaborative has brought together an amazing network of community organizations, employers, health systems, and health insurance plans that are working together to make our community healthier. Thanks to this group, you can connect with new friends, learn how to eat healthier, and stay active while you reduce your risk for diabetes. And you don't have to leave the safety of your home. You can sign up to take a class by phone or Zoom. Go to jefferson.edu/prevent-diabetes-PHL. Again, that's jefferson.edu/prevent-diabetes-PHL. Do it for yourself, for your friends, or for someone you love. Remember, you don't have to get diabetes. Be informed, know your risk, and take charge of your health. This is our last press conference before Thanksgiving, and we are well aware that this will be a Thanksgiving unlike any other. Of course, the holidays are usually a time when we open our homes to family and friends or travel to see those we love. It's a time of comfort and tradition where we share and remember and rejoice with those we most care for. But as you know, this holiday season, like this entire year, is totally different. For some people, these next few months will be tremendously difficult and even traumatic. For more than 8 months, we've all been living with this constant hum of anxiety, sadness, and confusion. Many of you face stress over health concerns, housing and wage insecurity, election anxiety, a summer of entirely justifiable social unrest related to structural racism, then the shooting of Walter Wallace Jr., and so much more. And now we're adding a significant resurgence of COVID-19 cases, while cold weather makes access to fresh air and open space more difficult. New limitations on gathering sizes and restrictions on indoor spaces add to our distress. There will be many of us who have a difficult time in the coming months. Impact on mental health during this time of continued and increased need for physical distancing takes its toll. It is these times that we need to remember that physical distancing and emotional distancing are not the same thing. We all need to ensure that even if we are physically distant, we remain emotionally close to those we love. So stay safely engaged, intentionally care for yourselves, and check in on your loved ones and neighbors. And to all, I want to remind you, nobody is alone in Philadelphia. Our city has developed one of the best behavioral health support systems in the nation. Whether you have insurance or not, whether you want anonymous support or need help for specific needs, the city is there to help you. Any individual feeling uncertainty and wondering whether they might need help can visit mindfultogether.com. That's spelled out mind, PHL, together, all one word, mindfultogether.com, to learn about the resources available via the Department of Behavioral Health and Intellectual Disability Services, Community Behavioral Health, Healthy Minds, and elsewhere. There's a light at the end of this tunnel, and we will get there together. So I'm pleased today that we are joined by Dr. Jill Bowen, Acting Commissioner, Department of Behavioral Health and Intellectual Disability Services, for any questions from the press on this important issue. Finally, I want to remind everyone, if you're going to start your holiday shopping this weekend on Black Friday or Small Business Saturday, be sure to do so safely. Wear a mask, avoid long lines, keep your 6-foot distance, and use online or curbside pickup options when available. And of course, take this opportunity to patronize our local businesses who need our support now more than ever. I'm pleased to be joined by our great school superintendent, Dr. William Haidt, for his thoughts about how students and families can be safe during this holiday week. Dr. Haidt, please.
Thank you, and good afternoon, everyone. And thank you, Mayor Kenney, for the opportunity to join you today. As the mayor mentioned, Thanksgiving is just 2 days away, and I wanted to take this time to reiterate to our students, our staff, and our communities the importance of celebrating the holiday safely. For many of us, this is a time to gather with family and friends, but it goes without saying that this year's holiday will likely have a different look and feel for all of us. As you know, we decided to put a hold on transitioning to hybrid learning this month due to the rising number of positive cases in Philadelphia and communities across the Commonwealth and across the country. In order to get to a point where we can begin to consider having students and staff return to school safely in the future, we must take some precautions now. I want to encourage everyone to listen to the advice of public health experts who suggest that for this year, we celebrate the holiday with our immediate family or those in the same household. Please limit the number of people for your Thanksgiving celebrations and continue to be diligent about wearing masks, washing your hands, using hand sanitizer, and staying away from others if you're not feeling well. Now is not the time to let our guards down. Like Mayor Kenney just said, we will get through this together, especially if we each play our part in keeping one another safe throughout this holiday season. Also want to remind our school communities that all district schools and offices will be closed Thursday, November 26th, and Friday, November 27th. This means that our tech support centers and hotline will not be available Thursday or Friday. This also means that we will have our grab and go meals available for pickup tomorrow, Wednesday, November 25th, instead of the normal Friday distribution service. Meals will be available at 63 school sites across the city between 9 a.m. and 2 p.m. on Wednesday. Families can find a complete list of schools serving as meal distribution sites by visiting philasd.org. In the season of Thanksgiving, I do want to extend my heartfelt appreciation to not just our regular teaching staff or our building administrators or all of the other staff, but to our food services team. This group of hardworking individuals have gone above and beyond during the pandemic. Since schools closed on March 16th, a dedicated staff have distributed over 5.5 million meals to our students who rely on the district for access to nutritious meals. And for that, we are truly grateful. So once again, Mayor, thank you for the opportunity to join you today. And I'll now turn things over to Dr. Farley.
Thank you very much, Dr. Haidt. We are still seeing very high case counts from the coronavirus here in Philadelphia, and we are seeing increases in the severe consequences of this infection. So everyone needs to be very careful during this next period of time to stay away from others. Here are the numbers. Since this time yesterday, we've identified 1,077 new cases of the coronavirus in Philadelphia residents by the PCR test, the standard test, bringing us to a total of 61,780 since the beginning of the epidemic. In addition, we've identified 45 people who are considering probable cases based on having a rapid antigen test only. Now, for the past week that ended on November 21st, we averaged 765 cases a day of the confirmed coronavirus infection. Now, so far, that's a decrease from the 888 cases per day the week before, but those numbers are still, for last week, are likely to increase with delayed reporting. We do know there are delays for us getting results from the laboratory. Among people that were tested last week where we have the results, 11.8% tested positive. That 11.8% is the same as the week before. So at least there's one positive thing here, and that is that percent positivity did not increase last week, and it's been increasing steadily from week to week before then. So there is some leveling trend here. And a leveling trend could just be a pause before we see another increase. It could be the beginning of a reversal. No way of telling right now. But even so, the number of daily cases we're seeing is still extremely high, and we're seeing the consequences of that. That's what's happening here in Philadelphia. And what about the region around us? We're still seeing very high cases everywhere around us. The state of Pennsylvania is reporting more than 6,000 cases per day. The state of New Jersey, more than 4,000 cases per day. Back here in Philadelphia, we're particularly concerned and watching our nursing homes. We are seeing more cases and more clusters in our nursing homes right now. That's particularly worrisome to us. In nursing homes, there were, for the week that began November 8th, we had a total of 84 cases in residents. And for last week, we had 52 cases reported to us so far. Both of those are a big increase from the 10 to 15 cases per week that we saw in August and September. Now, staff at those nursing homes and staff that are going to help those people in those nursing homes are trying very hard to contain the spread of the infection in those facilities, but it's not easy. Right now, we have 42 nursing home residents who have been transferred to the city's COVID relief unit. That is a unit specifically for nursing home level residents who have positive cases for COVID or have COVID infection, where it's safer to have them be there than to have their own regular facility to protect the people who don't have COVID in their regular facility. What about hospitals in the city? Well, the number of people who are hospitalized with COVID is growing here in Philadelphia and in the state as a whole. The state's database on hospitals is reporting that Pennsylvania hospitalized COVID patients is rising rapidly. It was more than 3,400 patients yesterday. For comparison, just last Thursday, it was 2,900. And both of those are new highs. They've never been this high before. Now in Philadelphia, as of this morning, we had 672 patients who were hospitalized with COVID. That's up from 542 last Thursday. The numbers are still rising, but to put in perspective, we peaked at about 1,000 cases last spring. So we know that we can handle 1,000 cases, but again, those numbers right now are rising. So we can handle this now, but I'm still concerned about that the hospitals may come under strain if we don't get this particular epidemic wave under control. What about deaths? Since yesterday, we've identified 7 new deaths from the coronavirus in Philadelphia residents, bringing us to a total of 1,960 since the beginning of the epidemic. Now, for the week of November 8th, by the date of death, we had 31 deaths. And by the week of, for the week of the start of November 15th, we've had 17 so far, but we know there's often delayed reporting on deaths, so we expect that number to rise. Both of those are a substantial increase from the 10 deaths per week we saw in September. So that's where we are with the severe consequences. Now, as far as testing goes, we are seeing a big demand for testing right now, a big increased demand. We think a lot of that is people who want to be tested before they travel for the holidays. But because of that, some of our testing sites are hitting the limits on how many people they can test. They're doing what they can. They're moving through the people that they can, but they are setting some priority. It's a higher priority for the testing sites and for the city as a whole to test people who have symptoms and to test people who have been exposed to COVID. Those are people who are more likely to be positive. We want to identify as quickly as possible to contain the spread from them. I just remind people that last Friday, the restrictions that we announced, our safer at home restrictions, went into effect. Remind people what they are. They are no indoor gatherings, no indoor dining at restaurants, no indoor sports, no gyms, no museums, no libraries. As far as retail stores, we want to be very careful. Retail stores have to enforce that people need to wear masks. Stores are responsible for that. There's also a limit on the number of people who can be in stores, 5 per 1,000 square feet. The health department will be sending teams of people starting today to visit stores to educate them about these requirements. But in the end, much of this is really going to have to fall on stores to enforce this reduced density for the safety of their customers as well as for the safety of the city as a whole. Outdoor activities under our restrictions are allowed, but they're with lower limits than we had before. And there's detailed guidance on all of our restrictions at www.phila.gov/safer-at-home. Now, yesterday, the governor announced new restrictions for the state of Pennsylvania. Those restrictions include a strengthening of the mandate to wear masks in the state as a whole, a requirement for people to work from home unless it's impossible for them to work from home. That wording, unless impossible, is stronger than the wording in the city's order about working from home. The governor's order also includes reduced density for gatherings, indoors and outdoors, and requirements that public schools in high incidence counties either attest to their following certain safety precautions or to go online only. Now, for other than the remote work requirement, the city's requirements are consistent with or more stringent, more restrictive than the state's requirements. I just want to be clear that for people in the city of Philadelphia, they have to follow the more restrictive requirements. They have to follow the city rules. People outside the city of Philadelphia and suburbs, they have to follow the state rules. Again, people have to follow the more restrictive rules. Then on a more positive note, let me talk a little bit about where we are with vaccination. We now have 2 vaccines that, by report, have been shown to be more than 95% effective. The first of those vaccines is under review now by the Food and Drug Administration. We hope that the Food and Drug Administration will conclude that the vaccines are effective and safe. If that first vaccine is, we are likely to start vaccinating here in Philadelphia in mid-December, maybe less than 3 weeks away from today. Now, our first allocation of vaccine from the federal government will give us a limited number of doses. And our first top priority group will be healthcare workers who are routinely exposed to COVID, such as hospital nurses that treat patients with COVID, or people who work at the COVID testing sites. We don't want to get those people infected, both for their own sake, but also so they don't pass the infection on to their patients. As we get more vaccine, we're going to be widening the criteria for who can be eligible for the vaccine. That's where we are today. Now, what should people do? Just to remind everyone now that we're seeing very high rates of infection, and we are seeing the severe consequences of such high rates of infection. So right now it's important for people to say you're safer at home. Stay at home as much as possible. It means work from home unless it's impossible to do so. Don't go to the workplace. And stay away from others unless it's necessary. Now, as Dr. Haidt mentioned, as the mayor mentioned, we are all very concerned about family gatherings at the upcoming holiday. We've given people plenty of warnings that they should have a Thanksgiving meal with their household members only, the people they're exposed to every day. But there were warnings over Halloween. We still saw a spike in cases afterwards from Halloween parties. So I want to reiterate again, please celebrate Thanksgiving only with the members of your immediate household. You don't want to spread COVID to your elderly grandmother or to that cousin of yours that may have a chronic medical condition that might make him severely ill if he got the infection. Now, if you have to go out, for example, you want to exercise, that's fine. Stay away from others. And when you're around anyone, anywhere, who's not a household member, make sure you are wearing a mask and make sure that they're wearing masks. Now, these next 6 weeks between now and the first of the year are going to be very difficult. We recognize that. But we are, in the big picture, close to the end of this. We've been through this for almost 9 months now. I'm very optimistic of where we're going to be in 2021. However, we need to get there safely. If we act responsibly now, we can save many lives over the next few weeks until we get to the next phase where vaccine is available. More information on all this is on our website, www.phila.gov/COVID. Thanks.
Thank you, Dr. Farley. Now let's go to Armando for the Spanish language translation of the mayor, Dr. Haidt, and Dr. Farley's remarks.
Palabras del alcalde Jim Kenney para el 24 de noviembre del 2020. Buenas tardes. En esta pandemia es fácil olvidar otros problemas de salud que afligen a los habitantes de Filadelfia. Y quiero tomar un momento para hablar de uno de ellos, la diabetes. En Filadelfia y a nivel nacional, además de en las personas mayores, estamos viendo una mayor incidencia de prediabetes entre las personas de color y los adultos más jóvenes. Sin intervención oportuna, muchos van a desarrollar diabetes, lo cual puede ponerlos en mayor riesgo de otras afecciones crónicas y complicaciones por el COVID. Hay proveedores comunitarios de confianza en toda Filadelfia que ofrecen programas de prevención de la diabetes. Lo que es mejor, no tiene usted que dejar la seguridad de su hogar. Puede inscribirse para tomar una clase por teléfono o vía Zoom. Vaya a jefferson.edu/Prevent Diabetes PHL, donde hay información y recursos gratuitos y también para hacerse la prueba de riesgo. En otros temas, esta es nuestra última conferencia de prensa antes del Día de Acción de Gracias, y sabemos muy bien que será un Día de Acción de Gracias como ningún otro. Como saben, esta temporada de fiestas, como todo este año, será algo diferente. Para algunos, estos próximos meses serán tremendamente difíciles e incluso traumáticos. Muchos de ustedes enfrentan estrés por problemas de salud, por inseguridad salarial y de vivienda, por ansiedad electoral, por un verano de malestar social totalmente justificable relacionado con el racismo estructural tras el tiroteo de Walter Wallace Jr. y por muchos otros motivos. Y ahora estamos agregando un resurgimiento significativo de casos del COVID-19 cuando el clima frío dificulta el acceso al aire fresco y a los espacios abiertos. El impacto en la salud mental durante este periodo de continua y creciente necesidad de distanciamiento físico pasa factura. Todos debemos asegurarnos que aun si estamos físicamente distantes, permanezcamos emocionalmente cerca de aquellos a quienes amamos. Y a todos, quiero recordarles lo siguiente: nadie está solo en Filadelfia. Nuestra ciudad ha desarrollado uno de los mejores sistemas de apoyo de salud mental de todo el país. Cualquier persona que siente incertidumbre y se pregunte si podría necesitar ayuda puede visitar mindphltogether.com. Hay una luz al final de este túnel y llegaremos hasta allí juntos. Finalmente, quiero recordarles a todos, si van a comenzar sus compras navideñas este fin de semana, el Black Friday o el Small Business Saturday, asegúrese de hacerlo de manera segura. Use una mascarilla, evite largas filas, mantenga su distancia de 6 pies y use las opciones de pick-up o de recogida en la acera si están disponibles. Y por supuesto, aproveche esta oportunidad para patrocinar a nuestras empresas locales que más que nunca necesitan nuestro apoyo. Y estas son las palabras del superintendente William R. Haidt para la ciudad de Filadelfia. Como mencionó el alcalde, el Día de Acción de Gracias está a solo 2 días. Quería aprovechar este momento para reiterarles a nuestros estudiantes, personal y comunidades escolares la importancia de celebrar el día festivo de manera segura. Como saben, este mes decidimos suspender la transición al aprendizaje híbrido debido al creciente número de casos positivos en Filadelfia y en comunidades a lo largo del país. Para llegar al punto en el que podamos considerar que los estudiantes y el personal regresen a las aulas de manera segura en el futuro, tenemos que tomar precauciones desde ahora. Quiero animar a todos los que escuchen los consejos de los expertos en salud pública que sugieren que para este año celebremos la festividad con nuestra familia inmediata o con aquellos con quienes compartimos nuestro hogar. También quiero recordarles a nuestras comunidades escolares que todas las escuelas y oficinas del distrito escolar estarán cerradas el jueves 26 de noviembre y el viernes 27 de noviembre. Esto significa que nuestros centros de asistencia técnica y nuestra línea directa no estarán disponibles ni el jueves ni el viernes. Esto también significa que tendremos nuestras comidas para llevar disponibles para recogerse mañana, miércoles 25 de noviembre. Las comidas estarán disponibles en 63 escuelas en toda la ciudad entre las 9 de la mañana y las 2 de la tarde de mañana miércoles. Las familias pueden encontrar una lista completa de las escuelas que sirven como sitios de distribución de comidas visitando filasd.org. En esta temporada de Acción de Gracias, quiero extender mi más sincero agradecimiento al fantástico equipo de servicio de alimentos. Desde que las escuelas cerraron el 16 de marzo, este grupo ha distribuido 5,5 millones de comidas a nuestros estudiantes que dependen del distrito para tener acceso a comidas nutritivas. Y por esto les estamos realmente agradecidos. Y esta es la actualización en materia de salud para el 24 de noviembre del 2020. Hemos visto un aumento en el conteo de los casos que trae severas consecuencias. Una vez más, les recuerdo, manténgase alejado de los demás. Comenzamos con los números. Hay 1,077 casos nuevos detectados por las pruebas del PCR, por un total de 61,780 nuevos casos. Hay 45 nuevos casos identificados por las pruebas rápidas de antígenos. La semana del 15 de noviembre al 22 de noviembre, el promedio de casos diarios fue de 765 por día. Los números tienden a incrementarse por los retrasos en los reportes. Sin embargo, hemos visto un descenso con respecto a la semana anterior, donde el promedio fue de 888 casos diarios. En cuanto al porcentaje de positividad, se ha visto un descenso del 11,8% con respecto a la semana anterior. Esta tendencia podría ser solo una pausa antes de otro aumento u otro cambio. Así que esperamos que comience el cambio, pero aún así, el número de casos diarios sigue siendo extremadamente alto. El número de casos en la región sigue siendo bastante alto. La semana pasada, Pensilvania registró más de 6,000 casos por día y Nueva Jersey aproximadamente más de 4,000 casos diarios. Hemos visto un incremento de casos en los hogares de ancianos y en otros entornos congregados. En casas de ancianos hubo 84 casos la semana del 15 de noviembre, mientras que la semana anterior, del 8 de noviembre, hubo 52 casos. Se ha triplicado la cantidad de pacientes en las unidades de prevención del COVID, espacios en los cuales los residentes de los hogares de ancianos pueden estar seguros de no propagar la infección por el COVID. En total, hay 42 pacientes de las casas de ancianos en estas áreas especializadas. El número de hospitalizados con COVID va en aumento no solo en Filadelfia, sino en todo el estado de Pensilvania. De acuerdo a la base de datos estatal, respecto a los hospitales, las hospitalizaciones en Pensilvania van aumentando rápidamente a más de 3,400 para el día de ayer, tomando en cuenta que a finales de la semana pasada el número de pacientes hospitalizados en el estado era 2.900. En Filadelfia, para esta mañana, hay 672 pacientes hospitalizados por el COVID. Este número subió de 542 que teníamos el jueves pasado, y recordamos que estamos aún por debajo del pico de la epidemia que tuvimos en la primavera. Estas cifras las podemos manejar por ahora, pero estamos preocupados porque los hospitales podrían llegar a su máxima capacidad pronto. Reportamos 7 personas fallecidas por el COVID el día de hoy, con un total de 1.960 personas fallecidas. Por fecha de muertes, la semana del 8 de noviembre se reportaron 31 fallecimientos, la semana del 15 habíamos reportado solamente 17, pero esperamos que estos números desgraciadamente aumenten. En cuanto a las pruebas, hay una gran demanda de pruebas por motivo de viajes. Algunos sitios de pruebas ya alcanzaron sus límites en cuanto al número de pruebas que pueden administrar, y estos centros están haciendo lo que pueden. Le están dando la prioridad a personas con síntomas, a personas que han estado expuestas a casos positivos. Con respecto a las restricciones de más seguro en el hogar entraron en vigor el viernes pasado. No se permiten reuniones en el interior y el servicio en el interior de los restaurantes, los deportes en los interiores, en los gimnasios, los museos y las bibliotecas. Con respecto a las tiendas minoristas, se requieren mascarillas para poder ingresar. El límite en cuanto al número de personas es de 5 personas por cada 1.000 pies cuadrados. Y estamos enviando equipos a visitar las tiendas para educarles respecto a estos requisitos. Las actividades al aire libre serán permitidas con ciertas restricciones. Hay orientación más detallada que se puede encontrar en fila.gov/Safer at Home. Las restricciones que emitió el gobernador de Pensilvania ayer indican un fortalecimiento del requisito en el uso de las mascarillas, el requisito de trabajar desde casa a menos que sea imposible. Este es un lenguaje más fuerte que el que da las órdenes de nuestra ciudad. La reducción en la densidad de las reuniones de personas, en interiores al 10% y en exteriores al 15%. Las escuelas públicas en los condados de alta incidencia deben dar fe de las precauciones de seguridad que están implementando, o solamente proveer instrucción en línea. Aparte del requisito del trabajo remoto, los requisitos de la ciudad son consistentes, congruentes o más restrictivos que los requisitos estatales. Finalmente, con respecto a la vacunación y las vacunas, hay 2 vacunas ya que muestran una efectividad del 95%. La primera ya ha sido revisada por la Administración de Drogas y Alimentos de los Estados Unidos y es probable que se comience a vacunar a mediados de diciembre, aproximadamente en unas 3 semanas. Los trabajadores de atención médica serán la primera prioridad, debido a que ellos están expuestos habitualmente al virus del COVID. Las enfermeras de los hospitales que tratan a los pacientes enfermos puedan seguir, el personal de los centros de prueba, seguidamente, y después se ampliará el protocolo cuando haya más vacunas disponibles. En síntesis, el conteo de casos se está incrementando exponencialmente. Ahora estamos viendo los severos resultados de este aumento y estamos preocupados por las reuniones familiares en las próximas fiestas de fin de año. Hemos hecho muchas advertencias, pero también las hicimos para la fiesta de Halloween y aumentaron los casos después de todas maneras. ¿Qué es lo que puede hacer usted? Usted se encuentra más seguro en casa. Por favor, quédese en casa todo lo que pueda. Trabaje desde casa si es que le es posible. No vaya a su lugar de trabajo. Manténgase alejado de los demás, a menos que sea absolutamente necesario. Celebre el Día de Acción de Gracias solo con miembros de su familia inmediata. Usted no desea transmitirle el COVID a un pariente anciano o a alguno que tenga una condición médica crónica. Si debe salir, por ejemplo, a hacer ejercicio, manténgase alejado de los demás. Cuando usted esté cerca de alguien que no sea un miembro de su hogar, utilice su mascarilla. Estas próximas 6 semanas serán difíciles, pero al final está cerca. Tenemos optimismo de que el próximo año traiga buenas noticias. Y si actuamos responsablemente ahora, salvaremos muchas vidas en las próximas semanas y podremos disfrutar de fiestas felices el año que viene. Todo esto depende de nosotros y juntos podremos superar esta tormenta. Muchas gracias.
All right, thank you, Armando. And we're now going to move to the Q&A portion for members of the press. The usual ground rules apply. Because of limited time, only one representative from each media outlet is permitted to ask questions, and reporters have to limit their questions to 3 or fewer. We, of course, are limiting this first round to the topic of COVID-19, including questions on mental health resources and on holiday safeguards. And a reminder that in addition to Dr. Haidt, we are today by Managing Director Tumar Alexander. And as the mayor mentioned, joining us for questions related to mental health preparedness amid the pandemic is Dr. Jill Bowen, the Acting Commissioner of the Department of Behavioral Health and Intellectual Disability Services. So if you have questions regarding other topics, please hold them if we have time for a second round, although at this point I would have to say that is very unlikely. If you're raised now and it is not on COVID, please lower it and we'll let you know if we have time later for other topics. Let's start off now with Jeff Cole of Fox 29.
Yeah, hello. 2 questions for Dr. Farley and then one for the mayor. Dr. Farley, a group of gym owners, a coalition of gym owners, had a workout today, apparently, at the MSB. They think that they could, they'd like to know whether, if they could come up with a different set of protocol, if they might be able to reopen prior to the 6 weeks. Do you see any way gyms might be able to reopen prior to the 1st or 2nd of January?
I don't, Jeff. You know, that there's no question that gyms do put people at greater risk. It's only 6 weeks. I'm sympathetic to the gym owners, but we do have human lives at stake here. And so I think people can exercise outside during that 6 weeks. I will say, because I'm sympathetic to gym owners, I should ask people who have gym memberships, keep paying your gym membership monthly fee so that the gyms can stay afloat during that 6 week period.
Dr. Farley, on testing, you said that that it's getting more busy and that you want to lay out priorities. Are you opposed to people testing to travel for the holiday?
You know, we're not generally recommending that because we're concerned that there may be too much demand that we can't meet, and we do think the other people are higher priority. If people are going to travel, there is some value to that, but I haven't been enthusiastically promoting that because of that concern that there are lower priority and there's only so much testing we can do. Our recommendations in general are don't travel for the holidays, stay here and just have the meal with your immediate household members.
And for the mayor, I think one of the difficulties of this Thanksgiving, of course, is that some people won't be able to see, in fact, their adult children who are younger, maybe less susceptible. I think you have children. Mayor, how will you celebrate the holiday? How will you be with loved ones or have any contact with loved ones who don't happen to live with you?
Well, I had this situation with my mother who's 80, and I was trying to figure out how to tell her that I wasn't going to be able to come over. I didn't think it was good for her, and I have a nephew that has some issues with immune deficiency, and she texted me over the weekend and said, "I think it's a better idea that you don't come." She said, "It's only a dinner. We can have dinner another time, and I'll just hang out with my fiance and have quiet dinner at home."
Mayor, don't you have a child? I mean, don't you?
Yeah, my children spend their not that it's your business, but my children spend the Thanksgiving holiday with their mother, and that's been that way for a while.
Thank you.
Let's go to Rosemary Connors of NBC.
Okay, great. Let's see.
You're up.
Okay, great. Thanks. Yep. My questions are for the mayor. And to be more specific, this is about the Philadelphia Fitness Coalition that did do this outdoor workout. If you're unaware, this coalition is made up of 30 plus fitness studios. So small group classes, like maybe 4 people in a class. It's not come and go as you please type of a gym situation. So that's who is out there protesting this morning. The Philadelphia Fitness Coalition says their data shows, and they did do tracing and tracking, no transmissions, that they are not happening in their spaces, and they want to know why they're closed down. What can you tell them?
Because for the entire time of this pandemic, I have been following the advice of public health professionals, and that's what I'll continue to do. All due respect to them and their data and their tracing, they are not public health professionals, and our public health professionals tell us this is the best thing to do to keep people safe. And again, as Dr. Farley said, I do understand their concern and their disappointment, but I'm following the public health professionals and their guidance.
In the beginning of this news conference this afternoon, you say that you support small businesses. Have you engaged with this community? Have you talked to members of this fitness studio community?
Not specific. I've had input from various folks, both in this community and others, but I understand the impact it has on business. But if the impact your death has on yourself is pretty substantial and pretty long lasting, and as more people we can keep from getting sick or dying, I think that's really the paramount issue here.
Final question for the mayor. Okay, so if these fitness studios and gyms are going to be closed for 6 weeks, which could mean the death of their business, is relief funding coming? Does the city have a plan to help them?
The city does not have money to provide for every business that's affected in the city. That should be coming from the federal government. It should be coming from the Congress of the United States.
But it's not.
Well, I understand that. We don't have it. I have a $750 million deficit and a $650 million school district deficit.
Can you be lobbying for it?
Yes, we are lobbying for it. And hopefully with Vice President Biden, now President-elect Biden, and hopefully we pick up 2 seats in Georgia, we can get some sense back to our government and get some help back to people.
Thank you.
Thank you, Rosemary. Let's go to Sean Walsh of the Inquirer.
Thanks very much. Dr. Farley, I was hoping you can clarify something that has been confusing, I think, to some readers about the rhetoric about how small private gatherings have been fueling the recent increase in cases. Do we know that for sure? Because we've seen some epidemiologists who said that the data doesn't necessarily support that, or it's that as well as the things like indoor dining that we had talked about previously. How confident are you that the recent surge is primarily because of small private gatherings?
I'm not sure I can say primarily because I can't put a number on what fraction of the increase it's related to. I can tell you that it's very common in our case investigation and contact tracing interviews to learn about spread in small gatherings. So I do think that they're important. I can't say that they're more than 50%, but I absolutely think that they're important to spread right now. So I did see that article, and I disagreed with the people who quoted that article.
I see. Okay. And as more broadly, are we implementing these since a lot of the business restrictions we just implemented don't have to do with small private gatherings? Is this just kind of not necessarily a bad way, but to throw everything in the kitchen sink at it because contact tracing isn't working out, that we're doing all these different restrictions? Or do we know for each of these, specific reasons why we're shutting them down?
We're doing a number of restrictions, trying to have them be the minimum possible in order to really change the trajectory of the epidemic, which would otherwise kill, we estimate, hundreds or perhaps 1,000 people before the end of the year. That's an awful lot of deaths. We have a model, we have models, I should say, in Europe where they have restrictions very similar to these, and their epidemics turned around quite quickly. And so we do think that this would be enough. But this is much less than what we did in the spring. So, I understand people being affected by this, being unhappy about that. But I do think we need to recognize how many people are dying and potentially could be dying, and that this kind of step for a limited period of time, saving them, seems to me to be worth it.
Thanks. And lastly, for the mayor, could you comment on reported plans by at least some members of the Mummers to hold some version of their usual?
I can't comment on that because I don't know who made the comments, the anonymous comments to another reporter. There are literally thousands of Mummers, and 2 or 3 men or women telling a reporter something doesn't mean it's going to happen. I suspect there'll be some activity down in the 2nd Street area where most of the clubs are located. But I don't expect any really organized group of people to do anything, because when the parade was canceled, they knew that they didn't have to buy materials for costumes and rehearse and do all the things they do to get ready for New Year's Day. So they won't be prepared to go out, and you may have some stragglers, but I don't sense it's going to be a problem.
And
all right. Thank you, Sean. Thank you, Sean. We are very short on time, and we have a lot of folks with hands raised. As I indicated by text, we're not going to have time for a second round today, but we'll try to squeeze in all the folks who have their hands raised. Now let's go next to Jack Tomzik of Metro.
Yes, this question is for Dr. Farley. In the spring, the Leah Core Center was utilized as a sort of field hospital. Is the city planning to set up another surge hospital space?
We don't have any plans to do that. What we found in the spring was that a greater need was for people who are nursing home level care who had COVID to be treated. We realized that if we set up a facility that could do that, we could transfer some of these patients who were taking up hospital beds into that facility, and that would free up those hospital beds for people who are more severely ill. And so that's what thinking led us to develop the COVID relief unit. And the COVID relief unit seems to be working as we expected. So we're hoping that will protect spread in nursing homes as well as keep the hospitals from getting overrun, and that may serve it more effectively than what we had in the Leah Core Center.
Okay, and with the new restrictions that were imposed Friday, have there been any violations, any businesses that remained open or operated against the violation or against the restrictions?
Our environmental health team has, on a fairly routine basis gone out and found places that were not following the restrictions, even from before restrictions as well as, I'm not sure if since, because it's only been a few days. It's been fairly common to find places that are not wearing masks and otherwise not following the rules. So I expect there will be some, but I'm hopeful that most of the facilities in the city will be responsible and try to protect the residents.
Yeah, and something I've heard from some readers and just people around the city, they're saying, well, I'm safe, I wear a mask, I'm at home most of the time, all my family members are, why can't we get together? What would you say to that? People say, oh, everyone in my family is safe, we don't do anything risky.
I would find it unlikely that any group of 5 people or 10 people doesn't have one person who's been out there exposed to somebody else. And everyone should wear a mask, but even masks aren't perfect. So if you're out there interacting with other people, you're at some level of risk. And getting people together over a big meal is a very high-risk situation. So I would strongly request people don't do that.
All right, thank you, Jack. Let's go to Martin Pratt of Philly YBN.
This question is for Dr. Farley. Dr. Farley, have you seen the report from China that was released in September that stated that about 39% of people who wear eyeglasses don't get COVID? They saw that a huge increase of people who don't have any kind of eye protection getting COVID in China. In light of that report, would you suggest that we all start adapting eye shields versus just the mask?
Yeah, I saw that study and I thought it was an interesting study. It does suggest that maybe the viral particles are being splashed in people's eyes, or the droplets in the air may be getting into people's eyes, and there may be some value to glasses. It's just one study, though, and one study that potentially have some biases to it. There haven't been other studies that have confirmed that, and national bodies are not recommending face shields for everyone. So we're not changing our recommendations now. I do think it's interesting. It's something we just need to have a little more research on.
The second question I have, and this is the last question, can you explain a little bit of what we're seeing in long-term issues when it comes to loss of the sense of smell and how the virus affects the cells inside the nasal cavity that goes to the brain? Because I think that people aren't really understanding it's not just surviving COVID. It's actually after you get COVID, French fries smell like garbage, and all these other smells that we're used to. Coffee smells like rubber burning. So can you explain a little bit about the loss of a sense of smell?
Yeah, so there's a lot about this virus that we're still learning because it is still new. And most people get over this infection fine. Some people get a severe infection, and some people seem to have long-lasting consequences. I don't know the details of that, but I can certainly, of what your question is specifically, but I can speculate that our smell is done through our respiratory tract, the same part of the body that the virus infects, just like the lungs. And there are cells in there that absorb chemicals that then we recognize through the brain. And if that lining is interrupted by inflammation because the virus is there, then things are going to smell different. You may not be able to smell at all. So that certainly happens during the acute infection for people. And it sounds like by a report for some people, there are changes that last a while afterwards.
Okay, thank you, Martin. Let's go to Danya Henninger of Billy Penn.
Hi, thank you. I guess this question is for Dr. Farley. So there's a disparity. Some people think there's a disparity between your recommendation to just stay home and the fact that there's a very public, city organization, I think Center City District run flea market around City Hall and Love Park. And so, it's outdoors, understand that there's outdoor dining, but it's like stay at home, but yet the city is throwing this big festival that says come out and do ice skating and things like that. Could you talk about that disparity in messaging?
Yeah, this festival is something that's done every year. It was planned well in advance of what we announced just a couple of weeks ago. And we had a choice to say, whether should we just cancel it entirely or should we put in place restrictions? And in view of the fact that it's outdoors and that we could put in place restrictions, we felt probably we could do this fairly safely. If it were indoors, we would have canceled it. So yes, we're not saying you must stay at home. This is not like we were in the spring where really we're saying everybody's got to stay at home. We're really encouraging people to stay at home as much as possible. But for this, given the large city is still a relatively small gathering, we didn't think that it would make sense to cancel it because it was outdoors.
Okay. A lot of other things are canceled, but sure. So
there are many things that are outdoors that are outright canceled.
Got it. My other question is just kind of a follow on Martin's question about are there any, when you survive COVID and the problems that happen afterwards, is there anything that we're tracking in Philadelphia about that? Like, do we've read studies from elsewhere, like hard to exercise after you've had COVID, even if you feel fine. Do you know of anything locally, or are you tracking it at all?
Yeah, the health department's not tracking that because our main job is to try to prevent people from getting infected in the first place. So we're kind of interested in what happens right up until someone gets infected, but the long-term consequences are not so much our responsibility. That is some responsibility of the medical care system. There may be studies being done by some of the researchers in the health centers in the city, but we in the health department are not tracking that.
Thank you. All set.
All right. Thank you, Danya. Let's go to Kennedy Rose of the Philadelphia Business Journal.
Hi, I have two questions for Dr. Farley. First, I was wondering, why is the health department sending out representatives to educate retailers about restrictions now? Is there any sort of urgency because of Black Friday and Small Business Saturday?
Well, we sent them out because we put in place the restrictions last Friday. And this is as quickly as we could put together a team to go out there. It wasn't specifically related to Black Friday. It was really related to the timing of the restrictions.
Okay. And how many people are on this team? And are they targeting any specific business corridors or any type of stores like grocery stores, small retailers, big box stores, et cetera?
The team today is 10 people, and they're somewhere in Center City. I don't know the details. And we will continue that, and they will probably move around the city over time.
Okay. Thanks very much.
Thank you, Kennedy. Let's go to Kristen Johansson of KYW.
Hi there. This is for the mayor, for Dr. Farley. So there have been studies about how safe it is to fly if you have a mask on. There's limited COVID, I guess, that comes into your airspace. Gyms obviously are different than restaurants because restaurants you can't have, you have to take your mask off obviously to eat or drink. So with gyms having masks on, what study are you looking at when you make the decision to shut down gyms?
Well, first, let me just point out that people aren't always wearing masks in gyms. Many people are uncomfortable wearing a mask when they exercise, and so it's difficult to enforce mask use. And we saw an example last week in that article from Philly Magazine of a gym that had lots of people who were not wearing masks. But then there is evidence from elsewhere that gyms are simply high-risk settings, probably to a certain extent because people are not wearing masks, and also probably to a certain extent because when you breathe heavily, you're putting more respiratory droplets out and getting more in. So the state of Minnesota tracks outbreaks, and gyms are among the more common places where they see outbreaks. And then there was a study that was just published a couple of weeks ago that looked at 10 cities across the country, including Philadelphia, and showed that gyms were important sites of community-wide spread, or important sites that promoted community-wide spread of the virus. So, people may say theoretically we're not going to have any risk there, but just the reality is that there is a risk in gyms.
And who did that study, just so we can look it up?
It was published in Nature.
Okay. And my second question is, with so many precautions in place, I guess this is for either for the mayor or for Dr. Farley, with so many precautions in place, discouraging people from gathering, why has the Christmas Village been allowed to continue to happen with people eating and drinking and shopping? I know you did speak about it before, but there's a lot of people that are, if you look out in the ice skating rink, there's people kind of crowded all around together. And then also, how is a Christmas Village different from other catered gatherings that have been restricted?
The Christmas Village is outdoors. We make a big distinction between outdoors and indoors. And there's a restriction in the Christmas Village as far as the density of the people there and the limits on how they can serve the food and how they can eat the food there. We had our inspectors out there yesterday and setting things up, putting limits on that. So it's along the lines of outdoor dining. Now, as far as outdoor gatherings and events, such as weddings, lots of opportunities for spread there. In those settings, people know each other. People mingle across tables with each other, whereas at a setting like outdoor dining, or in this case, the Christmas Village, people are generally not interacting with people at other tables, but they're strangers from people at other tables.
Okay, that's it for the question, but from a lot of the pictures and videos, if you go outside, there's like 50 people on the ice skating rink and a lot of people mingling with each other. So we're just trying to figure out what the difference is for restricted gatherings, outdoor gatherings versus the Christmas Village.
I'll have to
there is mingling.
I'll have to look at the ice skating rink specifically. What protocols I looked at were for the Christmas Village itself.
We don't have a Christmas tree lighting this year. We've done that remotely. It was filmed last night. So we're not bringing all those folks together, even though it's outdoors, because they tend to congregate around the stage and a live performance. And we've taken that precaution to keep too many people from gathering in one spot. As Dr. Farley said, you don't have to stay home, but you have to be distanced. And we believe that these regulations are putting people in the right distance and with masks on. I mean, you can go to every single example. I mean, we could be here forever going from example to example. This is what we think, based on the science and the medicine, what is the appropriate thing to do at this particular time. It could change. It could get stricter. It could get more loose after 6 weeks.
Okay, thank you, Kristen. Let's go now to Mike Donofrio of the Tribune.
All right. So I guess this is a question for Dr. Farley. Let's see here. All right. So you said you're seeing worrying case counts throughout the city, but what about Black and brown communities specifically? How are these communities being affected by this new wave, and are you seeing strains on testing sites specifically in those communities?
We are seeing increases in cases in all populations. I did look a week or so ago, and it seemed to be that we were maybe seeing higher increases in African Americans and other groups. That the groups that have higher rates has changed over time during the course of the epidemic, one way or another. In general, though, people who are less fortunate, people with lower income, are more likely to. So, at every time, but everything we can think of, we are putting in place right now.
Okay, thank you.
Thank you, Mike. And finally today, Manny Smith of CBS 3.
Just three quick ones from our team. First is COVID related for Dr. Farley or the mayor. We've seen the CDC and also Dr. Levine restrictions on people avoiding travel. Is the city planning on assisting or enforcement or any of those efforts, doing anything at 30th Street, bus station, PHL, as far as enforcing or encouraging the people not to travel?
There's no enforcement like that we have planned. I don't think it would be practical. I don't think it would be well received. We're simply recommending people not travel.
All right, cool. My second two questions are for the mayor. Today, Donahue Peebles, he's the guy with the family court building, says you guys canceled his contract unfairly. Any response to that?
I believe that the contract was about 7 years worth of wait. The potential for the development of the new hotel in the middle of this pandemic or shortly thereafter the pandemic is probably not strong. So we wanted to put it out again to see if there was an interest in some other use other than a hotel. And he's certainly welcome to reply again.
All right, cool. One last question from Stephanie Stahl with me.
Hi, this is for Dr. Farley. Dr. Farley, a lot of people are trying to get tested and with a negative test feel they are somewhat safer to be with family members for the holiday. Can you address a negative test and how that is not necessarily 100% sure for safety for people to be around family members for Thanksgiving?
Yeah, Stephanie, thanks for that question, because a negative test can be a false sense of security. You know, there's an incubation period, the time between when you catch the virus and when your test turns positive. That's generally 4 to 6 days, but can be up to 14 days. And so if you test yourself during that period, you'll get a negative test even though you have the virus, and you'll turn positive a few days later. So if you happen to test negative now, then by Thanksgiving, you may be positive and you may be infecting your relatives. But just because you have a negative test doesn't mean that you are not risky to others.
Manny, are you all set?
We are all set. Thank you guys very much.
All right. And thank you, everyone. That concludes today's COVID briefing. Have a safe holiday, and we will resume next Tuesday on December 1st. Thank you.